it's just skin cancer. That's a phrase our next guest hears too often when talking about the disfiguring disease. The reality is that 1 in 5 Americans will develop skin cancer in the course of their lifetime. Joining me right now is Annie Powell, the president of the World Skin Project. Welcome, Annie. How are you?
Thank you. I'm well, Steve.
Now, Annie, you were diagnosed with skin cancer at a very early age. Can you tell us a little bit about it, what happened in your life, and how old you were, and what happened the years after that?
Sure. When I was 16 years old, my mom actually encouraged me to go to a dermatologist because of my fair complexion, green eyes, light skin. And I had gone in to see a local dermatologist, and it was discovered that I had 1 basal cell carcinoma, which is the easiest form of skin cancer to deal with. And as time went on, I continued to go to the dermatologist because I was more susceptible to melanoma. So as time went on, I had more frequent skin checks, and then at 20 years old, I had my first melanoma, my first malignant melanoma.
Now, you said that your massage therapist detected something, or tell us a little bit about that.
Actually, a few years after my first melanoma was detected, I was a student at the Connecticut Center for Massage Therapy, and I was doing my externship at Market Square Wellness Center in Newington with my instructor, Scott Raymond. And Scott knew of my history with skin cancer, and as he was working on my back, he noticed a very, very suspicious dark spot on my back, and he decided to take action. He took a picture of it with my cell phone camera and showed it to me, so I went into the dermatologist, and it took about 4 procedures to get the entire tumor out of my back. I went up to Mass General in Boston at that point.
Now, how often do you have to keep on top of this kind of stuff now because of your history specifically?
I need to have a skin check every 3 months.
Okay. So tell us a little bit about what the mission of your organization is, what the Skin Project mission is.
So because of my massage therapist identifying skin cancer on me, we realized that it would be really important to educate massage therapists, spa personnel, body workers, hairstylists, nail technicians, to educate them thoroughly about early detection of skin cancers and skin abnormalities.
Now, you had mentioned that you did a survey recently at a place that we won't name, but it was, it was a spa.
It was a spa.
And what did you find out at a spa where they do massage therapy and all that? What did you find out when you did that survey?
Well, we surveyed massage therapists, hairstylists, and nail technicians, and there were over 50 employees surveyed, and not one of the employees could name the 3 skin cancers, nor could one employee name the 3 basic functions of the skin, any of the basic functions of the skin. There are 7, but nobody could name even 3. So we realized it's really important to educate people who are dealing with people's skin and have access to the skin for such an extended period of time. You know, we as massage therapists see people's skin more than doctors do.
Oh no, and I'm a big believer in massage therapy too. But the big question is, how do you get the word out to such masses about what you're trying to do? I would imagine trainers when you go to the gym. I mean, people like that. I mean, that are seeing you, tantally clad like that.
Yeah, absolutely. We've developed a workshop. And we've developed the workshop with some physicians out in California, some local dermatologists, and we've worked with the American Academy of Dermatology to develop this workshop. And we go out and we teach groups of massage therapists. This coming weekend we have a workshop in Jacksonville, Florida. We've taught here in Connecticut. And we teach at spas. We go out and teach this workshop, and because we're a nonprofit organization, so far the workshops, we've been able to do fundraising to have the workshops at no charge.
Now, what are some of the things that people can do this summer to protect themselves from the sun? Is it just a matter of a different sun factor, or what do you really need to do? Because
people like me should stay out of the sun altogether. And if you're going to be out in the sun, you need to use obviously a sunscreen of SPF 30 or higher, and even if you're using a higher sunscreen like an 80 or a 100, you should reapply it every 2 hours.
Now, and that's the thing, because we do want to get a little bit of ting. What's a safe way to get some color?
There is no safe tan.
No,
a tan is evidence of damage to your skin.
What about the spray places? We won't name any, but what about the places we can go in and they can hit you with the spray?
That's what I do. It takes about 30 seconds, and you can go and stand in a tanning booth. The cost is minimal, and you can have yourself a nice safe tan in 30 seconds if you choose to do so.
Yeah, and that doesn't do anything strange to you. That's all natural stuff. I mean, I get a little skittish about that kind of stuff too.
There have been no incidences of, and I do research this before I do anything as, a melanoma patient. there have been no incidences of anybody being harmed by a tanning booth. And
Right.
they've been out there for 10 to 15 years now.
Well, you know something, Annie? You're a walking miracle because you took the time and because the folks that were working on you, and a special, I mean, the fact that a massage therapist detected this. Folks, you've got to look for these things. If you're working on any patients out there, if anything else at all, you really need to check this out. If you'd like more information, go to WTNH.com if you'd like to check out anything else as far as just making sure you're doing the right thing. Annie, thank you so much for being with us.
Thank you.
Appreciate it. All right.